Hello guys. This is Dr. Rizwan Mirza. Welcome to my channel at Nephrologist. Today let's discuss about one of my favorite topics and one of the common issues worldwide. Renal failure, or kidney failure. It is estimated that about 2 million patients worldwide are affected by kidney failure. And the number of patients diagnosed with the disease continues to increase at a rate of 5 to 7% per year. And countries including Taiwan, Japan, Mexico, the United States, and Belgium currently have the highest prevalence of kidney failure. Broadly, renal failure is divided in two categories: acute renal failure and chronic renal failure. We will cover each one of these in separate videos, so keep connected to the channel at Nephrologist. Let's see how renal failure might present. Generalized body swelling. If you see you have developed facial swelling, or swelling on the feet, or you have generalized body swelling. If you have shortness of breath and have recently developed difficulty breathing due to fluid overload in the body. Or you have urinary changes like frothy foamy urine, or there is blood in your urine giving pinkish or reddish tinge to the urine. Or you have noticed that your urine output has decreased. It is mostly gradual decline in the urine, but you might notice sudden decrease in output with sudden loss of renal functions. Or you have raised blood pressures, especially even after you are compliant to your prescribed medications. You have nausea or vomiting and you feel generalized weakness and fatigued all the time. Or if you have symptoms like muscle cramps or itching without any known skin disease. Or you have noticed that you have been having difficulty concentrating on things and you find yourself in the state of confusion mostly. Or you have altered sleep pattern, or you are sleep deprived. There is a possibility you have developed renal failure. So how do you exactly know if it's renal failure or something else causing these symptoms? We confirm it by investigations. Check your blood counts. It might show decreased hemoglobin commonly seen in renal failure patients. Check urea, creatinine and electrolytes. Blood urea and creatinine increases in renal failure. Electrolytes get disturbed as well. For example, potassium might increase, or you might note decreased serum bicarb. Send urine DR, which might show albumin, protein or blood in your urine. If there is any element of infection or kidney stone, you might note raised WBC or bacteria and concretions in urine respectively. Ultrasound kidney, ureter and bladder might be done to rule out any obstructive or infective cause of renal failure. In cases of unexplained sudden rise in creatinine where other tests are insignificant, you might need renal biopsy to make a diagnosis of renal failure. Treatment depends on the cause of renal failure and its severity. Some patients with dehydration might need intravenous fluids, while other patients with volume overload might need intravenous diuretics, or intravenous antibiotics for infections. But in both the cases when the patient is having symptoms discussed earlier and there is deranged lab workup like very high urea, creatinine or potassium, or very low bicarbonate, patient might need dialysis. What exactly is dialysis? It is a medical procedure used to perform the functions that are of normal kidneys. Dialysis helps remove waste products and excess fluids and toxins from the body, which under normal circumstances is all done by healthy kidneys. So there are two types of dialysis. One is peritoneal dialysis. The second is hemodialysis. Peritoneal dialysis is a type of dialysis in which a special dialysis fluid is introduced into the patient's abdominal cavity through a catheter. The peritoneal membrane, which is lining the abdomen. It acts as a natural filter and helps by removing waste products and excess fluids from the blood through the membrane into the dialysis fluid. That dialysis fluid after a certain time is drained out and fresh dialysis fluid is introduced in abdominal cavity for next cycle. Keep connected to the channel at Nephrologist for more videos on peritoneal dialysis. Then the second type of dialysis is the hemodialysis, in which blood is drawn from the patient's body and filtered through a dialyzer or hemodialyzer. Inside the dialyzer, blood is exposed to a special fluid called dialysate, which helps remove waste products and excess fluids from the blood. After the procedure, Clean blood is returned to the patient's body. Keep watching my YouTube channel for more videos on the types of renal failure and peritoneal dialysis and hemodialysis. Subscribe to my channel at YouTube at Nephrologist and press the bell icon for updated video. You can also follow my page at Facebook and follow me on Instagram. And if you like the video, don't forget to like and share the video.